This has been a fantastic course. I'm so excited. I'm here taking the Implant Continuum. It's not my first time ever taking an implant course, but there's definitely not a course like this. Huge advantage is I'm here with some really good friends. CE is always so much more fun with friends, but honestly, it's such a small group, hands-on, and everyone just kind of feels like your friends and definitely becomes your friend by the end going through this experience.
Yeah, I just love coming down here to mentor these students. I love the program here. I love seeing sort of the light bulb go off in some of the students' eyes as we're going through some of the material. And then today, when we're actually seeing the live patients, how that's all put together. And just being able to reiterate some important facts and then actually watch it happen with our patients here.
I was doing extractions already in my practice, but no bone grafting or site preservation, and no drawing blood. Didn't know much about PRF, so it's been huge here to be able to not only learn it in a classroom setting, but also to practice it here in the clinic.
It's been 14 years since I've done any type of extractions or bone grafting or membranes. So this course is huge for me, and what was really exciting for me was I knew a few of the mentors here, and also a friend of mine. We've decided to take the course together. So we really got to learn together, and also with all these hands-on experiences, we got to work together and learn from each other, which just, it makes it fun. It's really nice to be here with a friend and be able to learn together.
The overall experience at 3D Dentist Implant Continuum so far has just been phenomenal. The hands-on aspect that we're getting compared to just being in a lecture and taking it back to the office and trying to figure out everything from scratch is nothing I've ever experienced before. This weekend I've done so many things for the first time. It's kind of mind-blowing, actually. I'm not someone who does a lot of extractions currently in my practice, almost none actually. And the fact that we have not only done that today, surgical extractions that I haven't done in years, first time sectioning a tooth in order to get it out, first time placing a bone graft, first time taking blood on an individual and doing things like that, first time working with a membrane. I haven't even placed sutures in years. So just getting a refresher on some things that I haven't done in many years, and then other brand new techniques has been pretty amazing.
The great thing about 3D Dentist and T-Bones practice is you take a course in a top-notch facility, but you're also able to do dentistry as part of the course on patients that wouldn't normally be able to afford that dentistry. So you're doing really good service for people in the area that now are set up for success later when and if they choose to do future dentistry.
Attending a CE course that gives back to the community is great. Not only do we get to learn, but we also get to help a community in need, and that's one of the reasons why we're in this field, is to help people. So the experience in order to not only get better in what we do, but at the same time help people is really great.
I think it's so important for us as dentists, as healthcare providers, to give back where we can, because we are fortunate to be trained in a skill set that can help take people out of pain, help them feel more confident in their smiles, and provide a service. And it shouldn't matter what your means or resources are to be able to feel good.
You know, as dentists, went to school to save teeth, that's what we do, but it's nice to realize that those teeth are still attached to people, and the people are part of our community, part of our lives every day, who we order a hamburger from through the drive-thru, or who we meet in a grocery store. So it's nice to be able to give back to the community, treat those people and their teeth needs, and to somebody that otherwise may not be able to afford it.
My experience at the Digital Implant Continuum was really out of this world. I've attended a lot of CE in the past couple of years, or over the 18 years I've been practicing, And the first day we learned about implant placement and were able to actually do exercises on models and get a feeling for the bone, go through all the different instruments that we'd be using and actually place implants on models. And it really gave me a good sense of what to expect when we get to a live patient.
I would absolutely recommend this course to other colleagues. It's a great introduction into grafting and implants, and it's a lot of fun, so absolutely.
The amount that I learned in these 3 days was phenomenal, but on top of that, the whole course was so engaging and also, dare I say, entertaining. You know, if you can laugh while learning and make it fun, I just think you learn more and you're engaged more.
I think what I really like is they want to push you. They want to make you uncomfortable. They want to make sure that when you go into your office, you're going to be super confident. So I'll admit I was pretty jittery at the first one, but now I got through it and I'm super excited, and I definitely feel more confident to go back into practice. I also know that they're going to be there. We're all texting each other, checking in. We have goals set. We know how many patients we're supposed to see in this next week, and we know that if we don't see them, then T-Bone, Sully, and JP will be harassing us entirely for the entire week. So I'm going to do it, and I'm really excited and a little nervous, but it's great. It's been really fun.